First of all, good morning, good afternoon, good evening to everyone who's on this line. Thank you so much for joining us. We want to first just let everyone know that there is interpretation today to Spanish and English and Portuguese. Most of the day's event will be in Spanish, but apologies from my side, I'll be doing my little bit in English. And as you can see on the slide here, there should be an interpretation button at the bottom of your screen, where you can then choose the language that you would like to hear our live interpreters. Thank you again for joining us for today's webinar, which is part one of our School Health in Latin America, Intersectoral NCD Prevention and Management. My name is Maria Hauerslev, and I'm the chair of NCD Child. And today's webinar is presented by NCD Child, and we are a global multi-stakeholder coalition championing the rights and needs of children, adolescents, and young people who are living with or at risk of developing non-communicable diseases. And to us, that means that we see NCDs as through the life course approach, and we are both concerned with prevention and control of NCDs. We have a secretariat, an excellent secretariat that is based at the Center for Global Child Health at the Hospital for Sick Children, or also known as Sick Kids. And our executive director is Dr. Sophie Kabuta, the co-director of Sick Kids for Global Health. And he will just share a few words with you now. Sorry, Sophie, I think you're muted.
Yeah, so thank you for the introduction and welcome everybody, all participants and panelists. We're absolutely thrilled that despite all the challenges of COVID-19, that this particular workshop is going ahead, and it's going ahead in a format that I hope will be useful to all of you in terms of exchanging ideas and getting many of the key messages out. As Maria has already said, the Secretariat is here to support the global mission of NCD Child. And our focus, particularly in the last year, has been on highlighting many of the issues associated with the challenges that children, adolescents face in the wake of COVID-19. Be those mental health challenges from school closures, be those the risks of non-communicable diseases and development of overweight and obesity in the context of reduced physical activities, and also challenges faced by many children with chronic diseases who are not able to access routine preventive, promotive, and curative care because of closure of health services. So I hope you will have an opportunity to discuss many of those aspects, and particularly those around health and lifestyle. I wish you the very best, and your deliberations and recommendations will very much feed into the work plan of the NCD Child Secretariat and its governing council and leaders, and we hope to be in close contact over the next several months as we develop our global agenda. Thank you very much. I will not be able to stay for the workshop, but you have our blessings, and I look forward to receiving from all of you your salient recommendations and key findings. Thank you.
Thank you, Sophie. And then we'll move on to thanking our the AstraZeneca Young Health Program for their ongoing support to NCD Child, and for their incredible support to make these regional workshops possible. And indeed, as you might know, this regional workshop was meant to be happening in person in Peru right now. So we're grateful that we have the opportunity to be online with you all today, although it would have been great to meet in person. And then last but certainly not least, I would like to thank our amazing and excellent partners and co-host for this workshop, the Coalition Latinoamérica Saludable and American Heart Association. Diana, please take the floor.
Gracias, Marie. Muchísimas gracias para nosotros.
Thank you, Marie. Thank you. just would like to thank everyone from the American Heart Association. It's been our mission to help out in order to have longer and more healthy lives. And I want to thank all of you who are with us today for being part of this dialogue and regional training program. It's been a pleasure to work with our partners, and we hope that we'll be able to advance the vision that we all would like to have a healthier world through the leadership of youth. So thank you, and have a great day today.
Buenos días a todos. Sí, gracias, Diana.
Okay, thank you, Diana. And good morning, everybody. It is a pleasure to be at this event. It's unfortunate that we were unable to carry it out in person as we had planned it at the beginning of the year. However, it's fantastic to be able to do it this way and to reach probably a greater number of people than had we done it in person. I am representing the coalition, the Alliance of the CLAS, and it is a non-governmental organization. It is the Healthy Latin America Coalition working on the NCDs. And we're dealing with a lot of different organizations, patients, youth, consumers. And it is aimed at the reduction of inequality, promotion of human rights, and in favor of impacting in favor of having better policies. And the Youth Alliance has really had an important part in the organization of this event. And there's going to be many people who are going to participate, panelists, moderators of this meeting. Even further on, we are going to launch the Youth Alliance for the first time. I would like to mention now briefly today's agenda. I'm not sure if you could please show the agenda. Very good. So for this agenda right now, we are in the opening remarks, followed by our main speaker. After, there's going to be a panel discussion with excellent panelists, 4 of them. And there will be an opportunity to ask questions, and there will be a question answer to the, this will be from the panelists themselves and also from the audience. And then we will have the launching of the Youth Alliance, followed by some closing remarks. Now, I would like to talk a little bit about today. First of all, we have translation from Spanish to English and also to Portuguese. Also, we are recording this event so that you will have the possibility of revisiting the content and sharing it with many other people. We would ask you to please keep your microphone on mute, silent mode, and while you're listening, if you do have any questions, please put them in the chat box where it says Q&A, question and answer box. So now what I would like to do is briefly mention why we are doing this. In our region, there's 5.5 missions of deaths caused by non-communicable diseases. In spite of the fact that we are in the middle of a pandemic which has terrible consequences in terms of morbidity and the death rate, also economic consequences that are important. The non-communicable diseases are killing a lot more people every year than what an infection such as COVID has. and 2 million people die by these diseases before the age of 70 years. So it's premature death, what we are facing. And the youth, children, this, in other words, in childhood and in adolescence, when we have the great opportunity to make changes. That's why we're carrying out this event, because we know that in order to change the situation that we have in terms of non-communicable disease, we have to have a strong relationship and be stronger at schools. Some non-communicable diseases have certain risk factors, and today, in the first day of this event, we're specifically going to be speaking about prevention. The risk factors, we're speaking of tobacco usage, unhealthy diet, physical inactivity, harmful use of alcohol, I already mentioned tobacco, air pollution. These are all factors that bring out certain diseases such as cardiovascular disease, cancers, and as well as other diseases. So at this time, I also want to mention the goals that we have, which is to critically evaluate the strategies of these non-communicable diseases transmission in the school. And it is important that we discuss this as well as prevention factors. We also want to deal with obesity, tobacco usage, and also we want to promote training of coalitions in order to have an effective change. I would also like to pass the floor. It'll be by video. We have a welcoming video by Dr. Anselm Helmes, who is the director of the Department of Non-Communicable Diseases and Mental Health at the Pan American Health Organization. He has made a great effort. He is speaking to us in Spanish. We would like to welcome through video Dr. Anselm Helmes.
Estimados delegados.
Dear delegates, it is a great privilege for me to welcome you to this workshop about school health in Latin America, prevention and control of the non-communicable disease. Schools are an important platform to educate children during their life when they are developing knowledges, attitudes for life, and healthy habits. The early experiences in life includes later lifestyles. However, according to a school questionnaire, the risk factors of non-communicable disease such as unhealthy diet, consuming of alcohol, unhealthy diet. These factors are clearly contributing to the development of these non-communicable diseases in adulthood. Well, the children have to be in school in good health, and we have to adopt a strategy, a wholesome strategy to prevent this. We have to be able to educate these children to have better habits that are healthier, that are linked to integral access for good health. And we have to have healthy behaviors starting from young childhood to later on. And they must directly involve members of their family as well as the community. we want to take advantage of the potential of our school-age children in terms of prevention and control or monitoring. The pandemic of the COVID-19 has changed our lives and it really has affected children in terms of restricting our daily habitual activities. There are certain high-risk factors in terms of work, and we have our youth advocates who are an important part of this piece. We have to recognize children's individual role as agents of change in order to deal with non-communicable diseases within the school environment. I hope that this extraordinary workshop will prepare you, each one of you, in order to deal with in an intercollaborative exchange and health sectors as well as education. So welcome to you.
Bueno, eso fue una excelente.
Well, that was a great introduction from Dr. Anselm Hennes. Thank you to PAHO for sending this welcoming message. Now I would like to present Dr. Lady Lema, who is going to present. Dr. Lady Lema is going to present our main speaker. She is emergency room and disaster specialist doctor. She's also the president of the Council for the Federal Student Medical Association. And she is part of the Youth Association for Wellbeing and Development. Lady, please go ahead.
Buen día, para mí es un gusto participar en este magno.
Good morning. It's a real pleasure to present our Dr. Sonia Cafe, who is currently the Regional Adolescent Health Advisor in the Pan American Health Organization. Dr. Cafe is a native of Suriname. She has she obtained a master's degree in health sciences and a specialty in maternal and child health and public health from the University of Arizona. She has worked at the University of Suriname. She has been collaborating since '98 at the United Nations and working with starting in 2003, she's been working at the Pan American Health Organization, working in the areas of HIV, sexually transmitted infection at the country, sub-regional and regional levels. And starting in 2015, she has been the Regional Adolescent Health Advisor of PAHO. And our main message is, if we look at the scale of schools as promoters, we can have a better health outcomes for children and adolescents. The global standards and the guide for these schools are currently developing and can help the countries improve and expand school programs. We're going to continue now with our main speaker. Good morning, and thank you very much. I hope you can see my screen.
Sí, vemos.
Excelente.
Yes, we are able to see. That's excellent. Well, good morning to everybody. And thank you so much for the invitation. It really is a pleasure and an honor to participate in this important meeting. And I also would like to congratulate you for continuing, because all of us, we have had to adapt to the current situation given the pandemic. However, life goes on, and we must continue with our efforts in order to improve the life and health and well-being of our children and adolescents. So I'm going to make a presentation on the schools, promotion of schools or promotion of health for schools as a platform in order to reach the SDG objectives number 3 and 4 of the SDGs. So in order to look at the context in which we are looking, it really is a pre-pandemic context because we really don't know what the reach of the impact of the pandemic will have been on these children and adolescents. We have some indications that we will need to discuss challenges not just related to the infection of COVID, but also the impact on lifestyle, risk factors of our children and adolescents as well. However, before the pandemic, what happened in the past 30 years is that we saw that there was a significant reduction in preventable death in children, a little more in children, also somewhat in adolescents. However, less advancements in terms of the reduction of risk factors. On the contrary, what we did see is an increase in risk factors. And in reality, as a summary, we could say that since the time period of the Sustainable Development Goals, during this time, the tendencies is more life, less health. In other words, an extension in terms of life years, but a lower level of well-being. And this is the context in which the world developed the Sustainable Development Goals. And in the extension of the SDGs, we developed a new agenda for health and well-being of children with a focus not only on preventing death, but also expanding and improving, strengthening well-being and the quality of life, not just the quantity or length of life. So some of the terms maybe one can say that are present a certain paradigm with respect to health, well-being of children and adolescents. We need to look at prospering, not just a questions of survival, but rather to prosper in order to facilitate well-being and optimal development of children and adolescents. In terms of interventions for children and in terms of ecological development, it is recognized that the links and the importance of the family within the environment for well-being, it has to be centralized in terms of the planning and the implementation on a local level, because we have to develop local solutions in order to respond to local challenges. From the health sector to multi-sectorial action, recognizing the importance of the social determinants and its impact on health and well-being in children and adolescents. And finally, in terms of the development of individual abilities, we have to go to strengthening systems. And when we're talking about strengthening systems, we're talking about life systems, ecological systems that interact with health in order to generate and promote health and well-being. So what are the implications of the new agenda that did not really begin in 2015 when we adapted the SDGs, but really is something that's in development. What we have to do is to assure in terms of these implications that we need beyond, it goes beyond health services and risk factors. We have to develop initiatives that can better facilitate carrying out the well-being and health. It doesn't matter where the person is starting from, not just physical well-being, but also mental, social, and emotional well-being, and also the importance of working in a safe and protected environment. In order to carry out these tasks and taking into account what is it that we have to do, development speaking, that each life stage needs in order to become healthy adults with an optimum level of health through their course of life. So this is a lot more wholesome or holistic and much more inclusive than before. So within this new agenda that we are developing together, we can identify different entry points, not just the health system and health services, but also, as has Dr. Anselm Hennis mentioned, the home, the community, the services of social protection. And when we're speaking of social determinants, also very important, the theme and matter of schools as places of teachings. So schools are identified as an entry point that is very important. They have many benefits.
The advantage at schools is that we can reach many kids and adolescents through the school platform. Now, I don't need to justify things because indeed Dr. Hennis mentioned many of these things. First of all, that a school is a social environment, not only an educational environment. We know that. We know that schools are places where children and adolescents can learn not only what they study in class, but to learn about life, about health, about well-being, and most importantly, parents also use the school platform to obtain information, and they trust the school, they seek advice and support in order to support their children and adolescents. Therefore, this is not only a platform, but a vital resource, I mean the school, to promote health and well-being in an equity-oriented manner, because we can arrive to all children and adolescents, and hopefully we can reach SDG number 4, and we will be able to increase the amount of children and adolescents that participate in school. So based on that, the WHO and UNESCO launched a new initiative in 2018. Each school is a school that promotes health. In English, make every school a health promoting school. So one can say that, but schools that promote health, that is not something new, right? The initiative of health promoting schools in our region as well, we're working on it for more than 15 years already, right? But at the global level and in our region as well, we can conclude that the implementation has been fragmented and in a certain way badly defined. We can say that because we made an assessment in our region concerning the HPS implementation, 2018-2019, and in this effort, we did analysis of programs coming from 16 countries. We reviewed the literature, we reviewed the policies, and this, of course, says about our region that unfortunately implementation is fragmented. There's sometimes vertical initiatives, not large-scale ones, and unfortunately we cannot take full advantage and maximize the promise, right, of HPSs in our country. Now, in the country of the global initiative, the WHO and UNESCO started to develop some documents and directives to strengthen the implementation of HPSs at the global level and in our region as well. Now, some documents they're working on are being done rather with a very interactive process with the regions, with experts. For example, the Murdoch Institute in Australia, and many experts are developing directives concerning school health services, global standards, and also operational directives. And I'm going to present you the global standards that are still at a draft stage. For a few weeks already, they closed a world consultation process, and in our region as well, we share the initiative for the participation of our region in finalizing the global norms. And I'm going to make you a presentation of where we are today, because I believe that standards really reflect the lessons learned and the way by which we can progress to strengthen the use of school as a resource to improve the health and well-being of children and adolescents in the matters that are approached by NCD Child. Now, the standards apply a platform, right? A green environmental platform. Now, I'm going to review this very fast in the few minutes that I have. These 8 global standards to improve and strengthen
esfuerzos de salud escolar.
School health programs and efforts. So, as I said, these are 8. Some have to do with government policies and resources. The idea being that when we work on school health, and what we can also see when we assess the region is that the ownership is important, meaning the school's ownership. But that can be very limited if we do not have an effort and if there are no national level contributions, reason for which standard number 1 has to do with a national commitment of the whole government, not only the Ministry of Health or the Ministry of Education, and this to improve the students and the community's health. Now, standard number 2 has to do with school level policies and resources. Number 3 concerns governance and leadership, because in many occasions, the Ministry of Health has the leadership having to do with school health programs, and they have to ask the Ministry of Education to collaborate. In other countries, it's the opposite. It's the Ministry of Education that has the leadership, and they have to request other ministries to participate. But what's very important is for there to be a defined governance mechanism that reflects the nature, which is a multi-sectoral nature, to head either national level or local level, maybe provincial or district level efforts. That's number 3. Now, global standard number 4 talks about the importance that community participation has, the parents, the students, the extension that school has in the community in a defined and organized manner, right? That's very important. Now, number 5 concerns the curriculum. The theme of health must be reflected in the official curriculum, right? Not only something that is done in a certain study or in a certain initiative, but really the curriculum has to reflect the importance that health issues have. And that must happen in a systematic way. Standard number 6, the social-emotional environment. And this reflects the importance that the social-emotional environment a school has, and we have to promote an environment that contributes to the social-emotional health and well-being in children and adolescents. Number 7, the physical environment, that is to say, there has to be a healthy, safe, and inclusive environment in school. For example, there must be opportunities to do physical activities at school, good food, etc. And number 8 has to do with school health services. That is to say, all students must have access to integrated service, not only in school and linked to school, but rather the importance of these links between school life and access to services is very important. There are fundamental principles, and this is the last thing I will mention. And I'd like to say that this is important for any issue we talk about as far as school goes. It has to be inclusive and equitable, and there must be a leadership in the educational sector, no matter who else is a leader, but the school must feel that it has to do this, that not only does it contribute to health, but also to the educational behavior. It's a win-win, as they say. Now, the focus has to be on all the school, rather in English, whole school approach, which means that not only are we going to accept an initiative or a study, but that there are really all the elements of the school that are part of the health program. Now, participation, I mentioned it already, is essential. And any intervention, any program must respond to the local needs. For example, we know that the matter of risk factors for non-communicable diseases are very important. We have an epidemic of obesity, of overweight, and if the school health program does not respond to that, if we don't respond, we're not responding to the needs nor to the local context. Now, this has to be something that repeats itself, that is continuous, not something short-term, but we have to learn, to improve, to continue, and that is connected to the matter of sustainability, not only to intervene when there are donors' funds there, but to invest with local funds because of sustainability and local mechanisms. And finally, there is the monitoring and assessment that are very important to make sure that we are generating the results that we pretended to generate. Well, I want to thank you very much to end, and I would like to say that at the global level, the norms are being finalized, and each standard has its own criteria. And I think that with this, we can strengthen again what we want to do. And I hope that in the non-communicable diseases and the work of NCD Child, we can really take advantage of lessons that are learned in order to improve school health and to reach the goal of transforming each school into a school that promotes health in a coherent manner. I thank you very much for your attention.
Agradecemos la intervención de
We
nuestra
thank very much the intervention of our keynote speaker, Dr. Sonia Café, and we will now have a discussion panel where we will talk about the promotion of non-communicable, prevention of the promotion of, non-communicable diseases through an integrated approach. Our moderator is Dr. Ana Larrañaga, who is the General Director of Salud Crítica in Mexico. And our moderator is a nutritionist. She has studied environmental health, diabetes health, mother and child health, and she has promoted public health policies that are evidence-based and concerning non-communicable diseases related to diet. She has also worked in the promotion of transparency, in transparent labels rather, in food and drinks, and policies against bad nutrition. She is today the General Director of Salud Crítica, that deals with the matter of diet, overweight, obesity. And we have a brief message on the part of our moderator. We, the youth, have the power and the strength to work on better policies for health and to improve the well-being of our communities. We base what we do on evidence, and we value our experience. Here, I will give now the mic to the moderator of our panel. Thank you very much, lady. Hello, good morning, good afternoon to all those who are listening to us from different regions. It's a pleasure to have you here today. I'd like to thank as well the people who are interpreting, because this enables us to reach a much wider audience. We have to take advantage, even in the current pandemic situation we are going through, and I am very grateful, therefore, for that. I am also very grateful for the fact that I can moderate today's panel. We're talking here about a subject, as was mentioned before, that is very, very important. It processes health in all the stages of life. So we must catalyze our action, and the best way is to do it in a coordinated manner with organization and with youth that already have previous experience. So we're going to start with our plenary panel called the Promotion of Prevention of NCDs. And we have 4 very, very amazing panelists. I'm going to talk about the goals we have today, because this forum has in its mind to have a collaboration focused on school health and how to promote health during COVID-19, and after that we want to assess the strategies and prevent CNVs in schools. And I think that we can also give opportunities for students to learn to reinforce promotion efforts. So these are some of the goals that we have in mind for this panel.
Y bueno, voy a pasar brevemente por los tiempos.
I am going to tell you how much time we have, because we do not have a lot of time. We have a bit less than what we had originally. So we will have 8 minutes per panelist, and we will then have 10 minutes for Q&A. So let me welcome our first presenter, Dr. Marco Ackerman. Dr. Marco Ackerman is a full-time professor at the School of Public Health at the University of Sao Paulo in Brazil. And he works in promotion of health. He has been a double PAHO consultant, and his research, which is very ample, has focused on public health, the social determinants of health. So I will ask Dr. Ackerman to be with us, and in 8 minutes, I will be controlling, moderating the time. I asked him to talk a little bit about what are some of the policy wins that we must have in mind short term, as well as the elements that you think that should change long term once we're back in schools after the pandemic. So Dr. Ackerman, kindly, I will pass you the mic. Hello, can you hear me? Can you guys hear me?
Le escucho bien.
Ana? Yes, I can hear you well. Okay, well, thank you then. It's a pleasure. Thank you very much for the introduction. It's a pleasure to be here. And I would first of all like to say hello to all the participants. I want to thank Nicola Gray, who invited me. She was my agent. She put me here to talk with all of you. I met Nicole through the UNESCO Chair of Health and Education, and it's a pleasure to be here. I want to thank you for the preparation, Laura, Jessica, all my colleagues who are here. I have profited here because at the beginning I was told that I have 3 minutes, and now you've told me that I have 8 minutes. So I am wealthy as far as time goes, because I prepared the text to read and I did a rehearsal, and it takes 4 minutes. So I have more time than I thought. I've sent the text to the interpreters, so it's written in Spanish, although I speak Portuguese, so I'll use Portuñol. I would like to thank the interpreters that can help us. And let's go to the text that I prepared for today. The title is "Children Are Not Islands. They are part of a continent." Now, this is the title of my short talk that seeks inspiration in John Donne, the English poet who wrote in the 17th century, and he ends with a sentence, for whom the bells ring. And I am talking about kids, so no child behaves as an island. each child is a particle of the continent of the earth, and if one child is forgotten and left behind, Latin America is affected. The death of a child weakens me because I'm part of human race. So don't ask for who the bells ring, because they ring for the children. We cannot talk about health in school and prevention of NCDs without talking about risk factors. Risk factors explain the causes of illnesses, but they don't explain how illnesses distribute themselves among races, groups, cities, schools. This has to do with the theoretical and political side of the social determinants of health. And the main source of social determinants is that there is an unequal distribution of resources and services and power among the children of all our world, be it based on where they live, where they study. And COVID-19 showed very clearly that there's an inequality in distribution, and rights are very, very vulnerable. At the beginning, it was said that this is something democratic because it affected everybody, that we are all in the same sea, but we're not all in the same boat. 1 second, please. The feeling of loss in the world can make us feel that we share a common destination, but we're not in the same boat, all of us. There's all sorts of boats, kayaks, there's sailboats, there's even cruise boats. And the story of the Titanic that had an accident in the Northern Atlantic ended up sinking. And one must understand that the place one occupies in society affects the risk one has to die. And vulnerabilities are different. 62% of passengers in the Titanic survived. 41% of the second class survived, and only 25 survived in the third class of the boat. So we need a committed social policy that will promote equity and won't hide the differences between social classes, genders, races, ethnic groups, territories. We must measure the differences as a point of departure in order to formulate a public policy that is fair as far as school health goes. We must recognize that one has a right to be different, and that we're not talking about a homogeneous standard. We're talking about a standard that's based on diversity. And other than focusing on the risk factors, one has to focus as well on the production and consumption means that we have in our capitalist society. We have to talk about structural causes, about the causes of the causes. We have to understand that the root is capitalist accumulation. For example, one cannot talk about healthy nutrition without talking about conflicts of interest that are embedded in harmful trade practices. And we must adopt the 2030 SDG agenda. We have to take into account the SDG number 12, and we have to fight for health in schools. But all of this is part of the past. In Yoruba, which is an ethnic African group, they say that Eshu, which is an African god, killed yesterday a bird with a stone that he threw today. So in order to better understand the sentence, we have to understand that we're talking here about a messenger, about an interpreter, that he's creating new roads for new things to happen. So when in the mythology he throws a stone behind him and he kills the bird of yesterday, he's reinventing the past. So we have, in fact, to re-inaugurate convergent and articulated, the participative, intersectoral, and interdisciplinary way by which children and youth can express their voice in any health project in the schools. Many times we hear health officers, we hear professors at universities, but we do not listen yet to children and youths, and therefore we must listen to their voices. And that is the message that I would like to share with you today. Thank you very much. Thank you very much, Dr. Marco. You really took 8 minutes precisely, so that was perfect. To tell you the truth, I think that we are entering with this into a conversation having to do with putting boys and girls at the center. And I think that that is the best way to end our conversation now.
Él es Jaime Delgado. Para quienes no tengan el gusto de conocerlo y conocer su trabajo, les platico que él es abogado. Él es un...
Let's talk with Jaime Delgado.
So I would like to now introduce Jaime Delgado from Peru. He protects consumers and users. He has been the person who is responsible from the legislature working on politics that are recognized for children in terms of having clear labeling. He is a promoter for children. Jaime, tell us a little bit about the experience in Peru. How has nutrition improved in schools? What is this legislation that was introduced? How is that helping the nutrition area? And if you can complement somewhat what Marco mentioned, how is this dealing with the children? How is it putting the children in, focusing on children? This is a little bit the thread that I want to follow. Thank you so much, Ana, and all the organizers. Yes, indeed. Peru has legislation, law of a healthy promotion of healthy habits for children and adolescents. This law was proposed in 2012, 2013, but it just came into effect in 2018, 2019 because of the pressure. There was a lot of pressure saying that this law should not be come into effect. However, this is something that has captured the market, the schools, and I'm saying this about the schools and the children because children, they are the favorite target of this industry in terms of consumers. So the consumers had the possibility of getting into these products in many ways, like school kiosks at the little cafeterias. They're full of junk food. It's also found in the classrooms because there's pseudo nutritional education, and these have found themselves into the classroom. And so there has been a strategy that has been developed not just based on social media and other influences, but it's also seen as some industrial kinds of little visits so that children can go visit the chocolate factory, the refreshment pop or soda factory, and knowing all of this as the background, in Peru, we have a serious problem. 32% of children between 3 and 9 years are already overweight or obese. And this number is growing into adults. More than 60% have adults are overweight or are obese. And during this pandemic, the children are seen to be even more vulnerable. So Law 3029 has established the first of all, to promote nutrition as education, as transversal education. Secondly, physical activity on a daily basis. A minimum of 30 minutes at the schools. We have already changed the idea of a course of phys ed once per week doing a sport. No, now it has to be physical activity every single day. In the third place, at schools it was established that they can only dispense these or only offer healthy nutritional food and exclude all food items that are not healthy, but also the measures that regulatory measures have stated that at the kiosk and lunchroom, these must be educational spaces. And this is very important because in many countries, except for Brazil, who have a very strong nutritional program at school and 40 million of consumers have hot meals available in many schools in Latin America, that does not happen. So they have the administration of a little small cafeteria or kiosk, and they see this just as a business. This is a profitable industry for them, not something based on nutrition. In Peru, we have changed it, at least in law, that says that this kiosk, these little cafeteria, has to be an educational space. It has to be connected with what is happening in the classroom, because it's rather curious. How are you going to do nutritional education in the classroom and then children go out in recess and they're going to find at the kiosk Coca-Cola, chocolate bars, and other soda refreshments? So that is why we are working on the development of this legislation. Last year, we organized a really beautiful forum. We were unable to repeat it. Educa Alimentaria, educate nutrition, and it's analysis in which we share the best experiences on a national and international basis in terms of all strategies for nutritional educational, something that is multidimensional, not just the responsibility of the teacher in the classroom, but it is a lot more complex. There are other elements, because children are not just rational. You can't just teach them educational nutrition by saying, oh, these are the vitamins and learn this by tomorrow and we'll have a test. No, children, they have tastes, sensations, memories. So in order to do nutritional education, you have to approach it in a multidimensional way. And the central idea of this space is to make it tasty and healthy, attractive for children, attractive, tasty, and healthy. How do we make it so that children can enjoy good food? We're not just going to put an entire plate of broccoli. Oh, this is healthy, you have to eat it. No, because we would fail if we do that. We have to have a greater integral or whole and holistic approach. that takes into account that children obviously have other expectations. The school garden is key for us because we are promoting that there would be a school garden, which would be school agriculture, because when children learn how to plant a seed and see how it grows and how we can then harvest the fruit to prepare our salad, these experiences are indeed important. So we do nutritional education when children at a very young age can learn to enjoy textures, smells, tastes, etc. And they learn to prepare the food items themselves. And in Latin America, we have a gastronomical richness that is unbelievable. We cannot lose this heritage. We have to promote it by cooking at home, cooking at school, and that is a very important piece of it. So I have a lot of expectations in that. Yes, there are challenges. And there is a bill that is established, the prohibition that Oaxaca did in Mexico, and we think that that's very interesting, to prohibit junk food to minors. We have established that all products that are in Peru for some time that are high in sugar and fats, there has to be a warning high in sugar and fat content. We have to have clear labeling. Do not eat it. And this has to be something that is advertised not just on labeling, but in other areas as well. So in other words, this bill is so that these products will not be sold to children. And it is just such a delight to participate in this debate in which we are all learning. Thank you. Thank you so much, Jaime. And you said it in time. It seems to me very, very important what you mentioned, above all, how the food has to be related to experiences and how these school gardens are an alternative that become something, turn into something very attractive to teach by way of experiences that involve you within your community, with the food that is produced on your land. And so this is one way that is a lot more palpable and which is a lot better to integrate this in all the different components that we are looking at in terms of healthy nutrition. So now I would like to invite our next, Meiling. She is a great leader and she represents the rights of consumer rights. We would like to welcome her. And I would also like to speak a little more about the role that youth have in order to initiate these changes within the school context. If we're still studying, we need, if we want to make these changes in our community, and you, Meiling, you are a youth person, so I look forward to hearing your point of view. Hello, and thank you so much for introducing. My name is Meiling Ho. I'm from the Republic of Panama. I'm 18 years of age. As everybody knows, chronic diseases are generally something that produces slowly over time, cardiac issues, cancer, respiratory disease. These are the main causes of death. 73% of death, according to PAHO in their 2016 study. There are children with chronic diseases more and more. So these children, their teachers have to face this situation and see how we're going to treat it in terms of basic needs. In Latin America, these illnesses cause all different types of diseases that will, these numbers as a consequence will be going up in the next years. So as the population is aging, there is greater exposure to risk factors. And the possibilities of obtaining these chronic diseases, these risk factors are the high consumption of junk foods, not enough physical activity, the not enough drinking of water, the high consumption of sugar drink, lack of good nutrition, excessive sodium intake. And I want to stress that there's children that are breastfed or infants, and that is important for the children's development. So as a youth, I am making a call for prevention because this is the cornerstone for the answer to these chronic diseases. We recommend political interventions on a parliamentary level to promote health. And in terms of the risk factors and chronic diseases that could occur in terms of children and adolescents. As a youth who just finished school, I'm going to speak to you a little bit about my experience. Nutrition of children is something that the parents are responsible for. They normally prepare lunch for their children, but what do they send with them? They send ultra-processed food products, pop or soda, juices with too much sugar, cookies. Very few times do you see children with fruit, water, natural juices. So it is recommended that we have to worry more about their diet because in childhood, they are more at risk to contract these kinds of diseases. Now, as a youth, as an adolescent, we go by publicity. If a certain pizzeria, a restaurant that has an ad of this pizza with these ingredients, we're gonna go. The same thing, a lunchroom, a certain lunch place, people are going to go there to buy there. So what I'm saying is we have to have a greater degree of awareness. The youth have to have awareness about products that we are acquiring, and children. In other words, the parents have to worry about the children's food. Now, schools, they have to worry about these kiosks that exist on their establishment. Many of them are selling these ultra processed food items. Others or some are not selling them, whereas others, they're selling soda, pop, highly processed foods. It's not good, and that's what I wanted to add. So thank you very much, and thank you for inviting me to this webinar.
Gracias a ti, Mei-Ling.
Thank you, Mei-Ling. Honestly, I think sometimes from the decision-making places, they need awareness of the strong role of that advertising plays. And in some countries, there is questioning whether, is this something that should be regulated or not? Is this something that's determined? And I think it's very powerful to hear it directly from someone, a young person who can speak from her own experience. And yes, this does impact us, and it does affect our health. So I think you really hit the nail on the head. Thank you so much for that. And now we're going to speak with our next panel member. And that is Dr. Esperanza Saron, who's coming to us from Colombia, and that is thanks to technology. She's the doctor from the Executive Director of Educar Consumidores, Educate Consumers, and she works a lot with being an advocate in terms of gender health, law, schools, and I could continue speaking about her, but let's welcome her. And Esperanza, I would like you to speak about what has your experience been in Colombia in order to advocate for healthier nutrition and healthier factors. And if you could speak about what's going on in the region, thank you so much, Anna. And thank you for inviting me to this lovely panel. We're able to share our important experience. Now, our experience, we have been developing it in term with our children, with our adolescents, and also through social media and other forms of communication. And we've carried out a great degree of work, not just with local and national government, but also with permanent presence in the parliament. So from 6 years ago, we have had someone who has constantly been doing follow-up on bills that exist, and also promoting a parliamentary table for public health, in which different parliamentarians come together working on these politics, and we've managed to have certain opening to a theme that is somewhat difficult in our countries. I can tell you, in order to speak of the challenges that we have in Colombia and what we have not achieved, even if we've been working on this for 6 consecutive years, presenting our bills for protection in schools, and also the possibility of taxing junk food and high sugar drinks. They've been 6 long years that we've been working on it. We've also been talking about open labeling, labeling that in order to promote health. And the challenges that we have, children and adolescents, they are part of the industry, the junk food industry, alcohol industry. These are the important youth that we need to highlight, because the industry, as our previous young panelist mentioned, the industry highlighting this advertising and promotion, focusing on children, boys, girls, and adolescents. They are the main focus today of advertising, and it is a universal challenge that we face, us who are in public health, because these sophisticated methods are getting to these children. So this challenge means not just we have to have social mobilization, but a lot of research collaboration from academies, from society, and above all, directly aimed at children in order to teach them from a very young age to face this invasion of advertising in subtle ways, in direct ways, involving children. In other words, that are involving children in unhealthy practices. We have to work at that. And looking at it a macro way, we have to look at health systems, education, as well as the systemic decisions of development in our countries in terms of the sustainable development goals, in terms of wellness, because our systems are fragmented, and we then see some systems that prevent us from integrating everything that Marco Ackerman spoke of, as well as Jaime Delgado and our young dear panelist, in order to bring these things together. Our health system is not trained, and we have to really work on that. And of course, this is a structural challenge that is very big. It's not, we have to discuss it. The other challenge that we have, and Mark Ackerman mentioned, it's terms of conflict of interest, not just in terms of from our politicians, but very important academics that are colleagues who are working in the health sector. And in order to be provided with financing for research, be it on the food industry, everything from sugary drinks, good nutrition, in order to it has to be put into law, because we have these conflicts of interest that affect being able to have adequate public health measures. And connected to this, there's also corruption, institutional corruption, which occurs, which is promoted from the large multinational food corporations, tobacco, liquor, who are also financing political platforms. And this is what's happened in Colombia. And this becomes a huge an important barrier in order to be able to develop political policies directed at youth, because we know that the right of the child has to prevail, regardless of any other right. However, today, the institutionalism, we have to go between the rights of the economy and the rights to health. And the pandemic has really shown us this debate that it's even more important. We see these two parts, health versus the economy, and how these two come at play. And the answers have to deal with this platform, let's say. There is another barrier, which is taking gains from health voices, and that is delegating all of the responsibility to the family, or on an individual basis to the parents of the child. Yes, of course, we have a responsibility, but in terms of communication, the pandemic, unfortunately, has been an example, at least in our countries, has been a negative effect in terms of what health education is. Why do we delegate all of the responsibility onto the individual? So if they're going to become sick, you're not using a mask. If they are consuming these products, it's because you did not educate them. It's the way you're raising them. So this is what our Panamanian comrade talked about, the possibility of or the challenges to compete in these minimal educational programs in the health ministries and education, and in general in society, faced with the enormous amount of advertising in which so much money is invested with all these kinds of factors. And in terms of what is delegated for that, it's an important factor. We have to point it out. And I would like to add something, a focus on school environments, a healthy school environments related to what was previously stated. And this has to do with mental health. And this is my final point. All of these elements are adding up one on the other and are gravely affecting children, boys, girls, and adolescents' mental health within the school environment, even more during the pandemic, when we've had to break that link or that connection of human relationships with children. At least now in our country, there has been a lot more have really been affected because of because of those who have be it computers in order to study. They are just being invaded with all this publicity. So I believe that we need to really think seriously as Mr. Delicate from PAHO stated, we have to add mental health to all these other factors, and we have to work on them. Thank you very much, Ana, and to all my other colleagues. Thank you, Esperanza, and thank you to all our panel members. I think you have touched some very fundamental factors that exist in Latin America. We really have a number of structural challenges and important conflicts. And this is really does affect the health of our minors and puts us in a counter position. We have to protect children's rights, and we also have to protect economic rights, and these two are at play. And in terms of decision making, we have to make the right decision in order to protect our children and our adolescents. And this is something that we are touching now. But I would like to leave you with Dr. Lady Lama, and she's going to quickly coordinate a question and answer session. People have been asking questions in the chat, and I just want to thank you so much for your participation. Lady, I will now pass you the floor. Thank you very much. So taking into time, we're going to be looking at two questions in particular. Can you hear me properly? Yes, we hear you well. Thank you. So we have a question to our panelist, Marco Ackerman. This is the question. How does research regarding in the school environment, how can that make contribution for prevention of non-communicable diseases? I would like to tell you that protect, promote, to protect children, to promote the children, we really have to be, these are factors that are different when we protect, when we prevent, and when we promote. These are three different factors and are very important in the territory of our school. And we have to look at the differences. I think that the effectiveness is in terms of prevention and promotion is going to be more.
And promotion will be more
important.
Efficient if it's in action together with social differences, interurban differences, gender, class differences. So I think that the intervention has to take into account gender, ethnic group, race, social class, so that later on one can propose measures that will be aimed at different social groups. That is why there's no guide for all the schools. I think we have to understand what schools we are dealing with, where those schools are. I don't think we can deal with all the schools in the same way. Thank you for your intervention. Now, our second question, and then we'll finish with this space. This question goes to Jaime Delgado. The question is as follows. What political actions in Peru have been implemented to stop the food industry? Well, to stop it is complicated, right? Because what are you going to stop? The strongest industry after medications and the military industry? Food has political power indeed, and it's impossible to stop it. But yes, things must be regulated. But as far as the conceptual side goes, I am a lawyer, and I've always worked on consumers' protection. And the measures to protect consumers are based on the following thing. You cannot put in the market a product that is a danger for the consumer's health unless everybody has the same risk. For example, cell phones put everybody at risk. But as far as food goes, there are food products that do not harm us because nature has given them to us for millions of years. That's where the alternative is. Industry has come into this activity, taking away something that nature had in its hands already. Ultra-processed foods are for war, things that never deteriorate, but they're not nutritious either at all, of course. Now, in theory, that means to say that any product that puts at risk the consumer's health, any of those products should never be sold. And that is why the law wants to implement warnings. For example, things that are high in sugar, in fats, there should be warnings. There should be a restriction as well, something that's dangerous for health because there's too much saturated fats or too much sugar. How should you make ads out of it? When you make ads, you are incentivizing the use of these products. So it should be forbidden to do ads for those food products, but that is the power of industry. It's a political power, it's power in the media, in society. So it's very complicated to fight against it, but there we are fighting. Thank you. May I make a comment, lady?
Sí, brevemente.
Yes, brief comment. Jaime, of course, the word to stop was to provoke you, but here in Brazil, there's something very interesting. The Minister of Agriculture asked us to edit the food guide in Brazil because, according to her, there was no scientific evidence to prove that ultra-processed food products could cause illnesses. So they wanted to stop us from intervening more, and there was an incredible mobilization in Brazil on the part of the civil society, international research, and one cannot stop what we are doing for healthy nutrition. So although the pandemic in Brazil was a terrible thing in our country, there's still signs that the civil society still mobilizes itself and can stop in a certain way the food industry. Well, to complement this a little bit, once we approved the law in 2013, the industry wanted to boycott this law. And in fact, it managed to modify it, but the president observed that amendment. The citizens' strength, though, has been so powerful. For 5-6 years, the industry wanted to get rid of this law for healthy food products, but people went out in their majority to endorse this law. And that was important because people were saying, if the industry is so opposed to these labels, this must be good for the consumer. And indeed, as a consequence of the new labels, it is estimated that between 70 and 80% of the population has modified their consumption behaviors. They've reduced the consumption of those products as a consequence of those new labels. This is fantastic. And as a summary, what is important when one wants a change through policies is that we must sensitize citizens. That is how change takes place. We have a question for our panelist, Esperanza Saron. How can we involve in an important manner children and youth in the process to create policies against NCDs? Is Esperanza Saron here? Yes, hello, of course. Something happened with my audio. Can you hear me? Hello? Yes, yes, we can hear you. Thank you. Seems like the camera has disappeared, but I'm here. Look. How to involve children and adolescents? We've had a few experiences, both in kindergartens and in some schools in different parts of the country. And how to involve them? What we have done, for example, has been to develop, when we have had the political and administrative will of the kindergarten and school principals, we've developed some strategies. For example, in our webpage, you can find a place where we deal with school health, with games, for example. And we also did some food fairs where we prepared together with the children some unthinkable food products like broccoli, several things, and then all over the school they could try what had been prepared with the intervention of the children. I think that that is one example. There are many, but I would like to indicate that, to connect it with the previous question made to Jaime and Marco's comment, I'd like to say that social media interventions in Colombia, we haven't been able to enter the parliament, but this great battle in social media, in different workshops, in local governments, in different social and community groups, has impacted the youth community. And although, I repeat, we haven't reached our goals, social media have today a very important role in entering this community and creating changes. There's an essential element that we learned from our Mexican colleagues, whereby when in our social and community work, we managed to awaken the indignation of people, not only parents, but adolescents as well. When they understand that they're being manipulated, there's a favorable, positive reaction created, where in Colombia, for example, it has brought a reduction in the use of sweetened beverages, for example. So we can see that we have managed to enter these groups through this system. That is essential. Like our colleague from Panama was saying, it's essential to connect to the students, that we ask the students, why are you using what you're using? Why are you eating what you're eating? Fathers, mothers that are concerned with their children, how to learn to look at the information given by the big industries. What is there behind it? What interest does our grandmother have in eating zucchini soup? Why should we instead eat products that can cause illnesses? I think that this is an important element that we could start to have, because like Marcos was saying, or everybody said it, we listen to politicians. These are repeated words. Everybody's committed with the children's health, etc. But in reality, there's a very big, ever bigger gap between what is said and what is done. And like Dr. Zuniga was saying, we have a longer life, but its quality is getting worse. Thank you for your intervention. Unfortunately, we don't have time with the rest of our activities. We thank those who asked questions through our chat, and the questions that were not presented will be responded to privately. Now, we have the presentation of Ana Larrañaga, our moderator, to continue with our program. Thank you very much. Well, this is the end of this panel. I think it has been quite rich, like Dr. Lady said. Unfortunately, our time is coming to an end. We could continue to talk about that, but we are going to go to the next presentation. And for that, I would like to introduce to you Ricardo Alemi, who will talk about the Youth Alliance for Wellbeing and Development. He studied at La Salle in Mexico. He's a big social activist in our country. He's a psychotherapist, and he coordinates health and well-being in Reflexiona, an organization that has done very good work to make sure that youth do not use tobacco. Besides that, they've also done very important work for safety in the streets, which has a lot of influence on the youth's health. So welcome, Ricardo. Hello. I would like to share with you the presentation. I will be brief. I have the pleasure to represent several youth in the region who want to generate a positive effect on development and health. We want to push young voices to get involved in health, in well-being, in social development, in economic development in our region. And we are youth that in some way are involved in these matters of health and development. And through our work, not only do we act, but we also have a critical sense of what's happening at the regional level. Who can join this group of youth that has as a goal to have such an impact? Any young person that has the interest to improve the current situation of the region. I would like to ask all of you to kindly follow us in our social media. For us, it's a great pleasure either for you to join us or to be aware of our actions. On Facebook, Alianza Juvenil Salud, and on Instagram and Twitter, Alianza Juvenil. You can either join us or follow us. And like Ana made such a good presentation, this is where I am now. These are our social networks. And well, I have no words to thank the important action of the Healthy Latin America Coalition, because while hearing all the presenters, I thought that it's, oh my God, irresponsible for the youth not to participate in things that affect our health. The different speakers spoke about it. Esperanza Saron spoke about it. The goal of industry today are children, boys and girls, and youth. And youth should be able to speak to industry and tell the industry that the way they do things is not the right one. So I thank very much the Healthy Latin America Coalition. That is all.
Quiero brevemente
I would
presentarlo.
like to introduce Bruno Hellman, one of the most involved people in matters of youth and NCDs. He is part of the International Federation of Diabetes and also of the NCD Alliance. He's also part of the Youth Alliance that Ricardo Alemi just presented to us. Bruno, please. Thank you very much, Beatriz.
Boa tarde, buenas tardes, good afternoon. I'm trying to be as fast as possible so we have more time for our breakout sessions that are coming next. So trying to bring a bit of everything that has been amazingly discussed on the past hour. I think summarizing what has been said is essential to first keep and put children and youth in the center of the debate. Nothing should be done or discussed, even nothing should be discussed or put into action if it's not consulted and if their opinion is not taken into consideration. Second, of course, we need to bring the parents, and education is important to help those adults to understand the harm that the unhealthy products make to their children's life. However, it's unfair and really unequal to put on the same level the responsibility that the parents of these children have as the industry of unhealthy products. As we've seen in the whole continent, the unhealthy products industry have been targeting youth and kids as they are more vulnerable and they have a high they are more sustainable to be impacted and influenced by the industry tactics. Third, the only way forward is increasing taxations over these products. We must guarantee that these taxes, once they are increased, they are directly straight to health actions, to health projects. Also, I believe that is important that we break the silos between health and the food discussion. We should put them together and we should make one single approach as a human right approach. And last but not least, we, youth and kids, are not only the future, we are already the present, and we must be taken into consideration. We must be involved in the whole project, and we must be heard, involved, and be the protagonist of all this movement. Now, I'd like to invite everyone to join our breakout sessions. You'll be receiving an email, and that we're gonna have 4 main topics. The first one is sugar sweetened beverage versus water. The second one is responding to tobacco's newest products. Third, school food environment. And 4, physical activity in the school environment. I'd like to thank everyone that participated throughout the day, and reinforce Ricardo's invitation to join the Aliança Juvenil, and let's make our voice be heard in our continent. Thank you very much.